Summit 6, Round 5, Group 8. We looked at enabling systems, conditions for implementation of GMP. And what we looked at was the systems that will need to be in place and implemented in order for physicians to be able to fulfill the recommendations from the GMP. And what we need to have is information systems that facilitate the sharing of patient and practice data and outcomes and allow physicians to do competency and change in practice, patient safety, patient outcomes, data comparable, interoperable, user-friendly, single entry without redundancies. Also, a just culture is needed. We need to transition to a just culture in lieu of current malpractice system. So we look at correcting errors, education when the system error or person for the system rather than the person, and discipline only if it's an intentional harm to the patient. We need clarification of shared liability for the teams, the practitioner, for the healthcare system. We need adequate healthcare workforce, all the professions on the healthcare team and their competence system to educate the public about good health habits and self-care. And then we need reimbursement linked to patient outcomes and for patient get paid for results. Reimbursement that promotes the best use of the workforce, and culture of learning and improvement with leadership, role modeling across the organization, team learning, counter blame and argument, rewards for learning, and then finally we need resources for systematic specific remediation so that when we identify physicians who need retraining, we have good educational venues for them to proceed to. Finally, we need access to healthcare for all, whether that's meeting insurance for all, and then also availability of clinics and times. And then we need lawmakers and regulators to be well informed about system conditions. And then we looked at next steps, inventory of where good system conditions do exist, look for points to leverage a culture of learning, what could the Alliance do, get feedback on the list of system conditions for GMP, identify opportunities for early wins to create system conditions, and develop message for key stakeholder member groups such as lawmakers, regulatory agencies, patient advocates, and about the need for system conditions.
I can't stop it.